I'm a professor of psychosocial work environment and health at the National Research Center for the Working Environment, Copenhagen in Denmark. This is a governmental research institute. It's like NIOSH in the United States. So we are doing research on work and health. In addition, I'm affiliated professor of psychosocial medicine at the section of epidemiology, Department of Public Health, Copenhagen University, and also together with Alex Burdorf, editor-in-chief of the Scandinavian Journal of Work Environment Health. The research I'm doing is on psychosocial work environment and health, how working conditions, psychosocial working conditions affect people's health, workers' health, and what we can do about this. And I got into this area, maybe about 30 years ago or so. I'm coming originally from social psychology. I think it's fascinating to do research on how working conditions, how things such as influence at work, how work demands, emotional demands, workplace bullying, how they can affect workers' health and well-being. So this series was commissioned by the Lancet, which means that the Lancet contacted us. They contacted me in January 2021, actually, some time ago, when they said they would be interested in doing a series of couple of papers on work and health. And and I was interested in, I was actually very excited that a medical journal such as the Lancet got interested in the question if and how working conditions can affect population health. I think this is a topic that is undervalued, and so we wanted to contribute to this. And then we assembled a research team to do this, and we came up with 3 papers, and we were a total of 15 scholars from 9 countries. Paper 1 is on work as a social determinant of health, and we reviewed the literature there, and we come up with a recommendation. Paper 2 is on work-related mental health conditions, on the causes and possibilities for interventions. And paper 3 is on health and inclusive labor force participation. I think one of the main messages we have there in the paper, or maybe the main message, is that work is a lever for improving population health, if work is good. If work is bad, if work is poorly organized, then it can be a threat to health. But if work is well organized, if we realize also the potential of good work, then we can contribute to a better population health. And I think this is a really exciting topic. And so we try to elaborate this in these 3 papers, where we reviewed in each paper tons of literature and discussed this critically. And then we came to recommendations in each of the papers. This is also a challenging topic. Can working conditions really so powerful? Can poor working conditions be so powerful that they can contribute to the development of a clinical depressive disorder, for example, or anxiety disorder? Our conclusion is that we identified several working conditions that were associated with an increased risk of developing depressive disorder. And this depressive disorder is the only condition where there is good literature. For other disorders, such as anxiety disorders, for example, the literature is not comprehensive or good enough to make conclusion. But for depressive disorders, we see quite a strong association between being exposed to workplace bullying and a later increased risk of developing depressive disorder. And we also see associations between working conditions that are conceptualized as stressful working conditions in accordance with theoretical models, such as the combination of high demands and low control at work, or the imbalance between high effort and low reward at work. or being exposed to injustice at the workplace, that these factors were associated with an increased risk of depressive disorder. And then when we assess this, we see, yes, some uncertainties remains, because these are observational studies, and observational studies come with some uncertainties. But if we take all the evidence into consideration, it is our assessment that the evidence is strong enough to call for action, for improvement of working conditions, and for in particular addressing these factors that we identified. So this is the first part of the paper. And the second part of the paper is then another review, a narrative review on what can be done in terms of interventions. And we followed there a model that was in particular developed by Tony Lamontagne, who is one of the co-authors of the paper, which focuses on, this is a complex field, but to make this more simple, on 3 simple messages: prevent harm, that is, address these working conditions, for example, such as workplace bullying, that are associated with an increased risk of mental disorders, reduce these factors or eliminate these factors. Second part is promotes positive, focus on working conditions that research shows that there are positive working conditions that can contribute to better mental health of workers, for example, increasing workers' control over working conditions. And the third one is manage illness. When it comes to what works in terms of intervention, our focus is clearly on work organization. I mean, there are also important individual approaches for workers. There are programs, for example, for workers who have a mental health condition to provide some help for example, CBT and these kind of things. But our focus is on working conditions, through the improvement of working condition to improve workers' mental health. In another paper that was also published here in this year, was published in the Scandinavian journal Work Environment Health, we did there another umbrella review, but this time specifically on organizational level interventions, and which organizational level interventions are effective. We had included about almost 1,000 studies that were reported in reviews, in systematic reviews. And here we conclude that in particular interventions that are aimed to increase the influence of workers seem to be effective, particularly when it comes to increasing workers' control over working time. These interventions seem to be in the literature effective with regard to workers' health. And now this is workers' health in general. It's a lot about mental health, but it's not limited to mental health. But also interventions that aim for increasing workers' influence in general seem to be in fact effective. And also we saw in this review that interventions targeting burnout, organizational level interventions targeting burnout, which includes both reducing demands at work, increasing workers' control, increasing social support at the workplace, improving work organization, they seem to be effective. This where we found the strongest evidence. There are some empirical studies where they introduced a new system when you make the schedule, for example, the working time schedule, and then there is a possibility to include workers and their needs there, in particular when this is done in a participatory way. I think this is also key, that these are not interventions that are done top down, but that there are participatory interventions that include workers and their needs. There's of course also the need for the company, and this needs to be balanced. but we think in particular these interventions that are participatory, that are listening to the needs of the workers, that they are successful. If I should have one word, I think it's as I said before, it's a word participatory. So include whatever you want to do there. Don't do it top down. Involve the workers in designing the solution. I think this is key. But then it's very different. I mean, it's very different if you are addressing, let's say, a high level of emotional demands at work that you have in certain occupations, like in healthcare, for example, or if you address workplace bullying or harassment, or if you're in generally work with including influence, or if you address if you address things such as the meaning of work people feel, or the level of role conflicts or role clarity. So this is psychosocial work environment. It's a broad area which also would require different steps to address this. But I think if it's one thing, I think participatory is important. At the Lancet, they have a very much a global health approach, and but when we reviewed the literature, we could also see, well, the good studies, the methodologically good studies, are usually coming from the high-income countries, and therefore our papers are very much limited to research from high-income countries, which is a limitation of our papers. And actually, the Lancet then finally accepted this, that we say, well, this is the evidence that we can provide, but to balance this, there are two invited commentaries in the series, and these two invited commentaries by other research teams, they focused in particular on working conditions in low and middle income countries. I think this was also a very good approach by the journal to have this balance. So this is slowly going in this direction. Particularly, the funding agencies at the European Union, they request that you have diversity in countries when you're doing this research. Mostly the research is in Sweden, and now we are also doing this research in Denmark, where we have a stronger focus on precarious work. Because also in our countries, it seems like precarious work is increasing, and precarious work also increasing because of technology changes. And so we have research projects there, and we're starting research projects, both epidemiological research projects, but they're difficult because precarious workers, they are difficult to reach. And if you want to do the large analyses, these might be difficult, but then we are trying also some qualitative research studies. Colleagues of mine did qualitative research studies about young people who are working in the gig economy and who are precariously employed, and where actually it's quite unclear, are they really employed or are they self-employed, and what other conditions are. And so we are trying to do more research on this, and it's important because, as we also argue in the paper, those people who are who are socially disadvantaged, or are of low socioeconomic position with regard to several indicators, they often are exposed to poor working conditions, and therefore also have an increased risk for mental disorders. When it comes to regulation, I mean, this is this is not only research. This is also about power issues and negotiations, political negotiations, and then this depends on so many factors. Traditionally, in the Nordic countries, and now I'm coming from Denmark, we have this tradition with a lot of focus on work environment. And actually in 2020, Denmark had an executive order on the psychosocial work environment. But this was also for the first time. So it took also until we got this type of regulation. We have other type of regulations, but they have this specific executive order on the psychosocial work environment. It took us until 2020. In 2022, we had these the big WHO report on mental health at work, which was a major step. That WHO recognized the contribution of work to mental health, and many excellent colleagues contributed to this report. But then also that the Surgeon General had their own publication on this topic. I think this was very encouraging because you said, well, United States is often lacking behind. Yeah, might be true, but I think also there is something going on in the United States, and I think this was good to see that there is also at the level of the Surgeon General an acknowledgement of the importance of work for mental health. So I found this encouraging.